everybody, it's Elisa. I'm back, and so this time we're going to be talking about some receptors actually that are very key to regulation and homeostasis in the body. So they are the baroreceptors and the chemoreceptors, specifically of those found in the vasculature, because it's the blood vessel chapter. Okay, and just to kind of clarify, I had somebody ask what vasculature is. So the vasculature is the architecture of the vessels in the body, where they are, where they're going, are they big, are they little, what are they doing there? Yep, all right, so let's go ahead and get started. So what's important to understand is within the blood vessel walls, specifically we're going to look at arterial, there are sensory organs. And so these sensory organs are going to sense pressure and chemicals, right? So the pressure ones are the baroreceptors, and then, sorry, maybe wants to join my iPhone hotspot. There you go. And the second is chemo. Also, that's easy, right? So these sensory structures are found in the walls of like the larger or the major vessels. They monitor things like pressure, right? So the baroreceptors are going to do that. And then the chemistry of the blood at the point. So those are the chemoreceptors. What they do is they actually use that information to regulate the heart rate. And they do it by expanding or contracting the blood vessel diameter. And they also can have effects on respiration as well. So the carotid sinuses are going to be baroreceptors. So just as you can imagine, carotid is going to be near the internal wall of the carotid artery, right? So this is an artery that goes through neck and head. So this one specifically is monitoring the blood pressure, and it's going to transmit signals. There the glossopharyngeal nerve, right? So glossopharyngeal nerve is going to actually kind of just sense kind of the pressure as a baroreceptor, how high of a pressure is the blood that's coming straight off of the aorta in the heart, right? Because carotid artery comes right off of it. Oh my gosh, I'm so sorry I yawned, you guys. Oh, somebody needs some coffee, and that person is me. Anyway, so it allows for this thing called like the baro, you guessed it, reflex. And so this can be an important thing to, we will talk about this in just a little bit, especially as it pertains to things like, histamine type, like antihistamines. Okay. So within the carotid artery, you have the carotid bodies that are also the chemoreceptors. They're interesting because they're little like ovals actually near some of the common carotids. So they're going to monitor the chemistry of the blood, and specifically they're looking at respiratory rate indicators, so things like CO2, O2, all that good stuff. So they're also going to use the glossopharyngeal nerve to kind of talk to the brain, especially when it comes to, do we need to speed up or do we need to maybe slow down respiration rates, okay? So again, these are chemoreceptors. So there's 1 to 3 bodies in the aortic arch. And so if you remember, the aortic arch does like this. And there's 1, 2. This in a nutshell, right? So this is like what the aortic arch is. It is up here at the top, just coming off of the heart itself. Okay, right. Oh, yes, and it's going to be innervated by vagus nerve, right? Vagus, baby. So Big Ten is going to be what kind of regulates the heart rate. And for the most part, it actually tells the heart to slow down. It says you're beating a little too fast, guys. So, right. Here's what it looks like. As you can imagine, so here's aortic arch right here, right? And here's our 3 branch points. Okay. Baro or pressure receptors are right here because this is actually the highest pressure of any of the vessels in the entire body. So it's like a really good way to sense it, especially for the heart. Carotid sinus, as you can see here, is like a bigger opening area. That's gonna have the baroreceptors. Oh my gosh, is that 2 yawns? Oh my goodness, you guys. Is that 2 cups of coffee I gotta get now? Oh, I think it might be. Right. And so that's where you would find them. They're actually kind of like just this area. They're not like organs like dissectable, like large scale organs like kidneys or brains or, anything like that. They're actually kind of like modified patches, if that makes sense. Okay. All right. I think that's pretty much it. So other things I wanted to talk about. So the baroreceptor reflex, let's talk about that just really quickly. So the baroreceptor reflex is what causes changes to overall blood pressure. So one of the things that we know are certain drugs impact this quite a bit. Drugs like alcohol, of course, drugs, illegal drugs, legal drugs, but especially in children. I think it's like the commercial name is Benadryl. It's an antihistamine, and so Benadryl can act in younger children who are still developing their baroreceptor reflex because you are not born 100% developed. Oh, you poor things. If you have kids that are too young, this actually can affect their baroreceptor reflex so negatively that they can cause overall heart failure. So that's one of the reasons why Benadryl really has kind of, unless it's an emergency, you really don't want to give it to kids under certain ages. And I think, that age restriction has actually gone up quite a bit. I don't know where it is right now, but I know that it is slightly kind of creeping to older and older ages for that reason. Okay, and that's it. So those are some ways that blood pressure is stabilized outside of the heart. Things that are used are primarily going to be control over the arterial width, right? So if we need higher pressure, we're going to make that inner lumen smaller. If we need like lower pressure, one of the things that we can do is we can actually make the lumen larger for lower, right? And then higher, right? Okay, and I think that's kind of really it for now. All right, so I'm going to go get those cups of coffee. And I, in the meantime, hope you are having a wonderful morning. Okay, bye bye.